Hi, this is Matt Baney, managing editor of the Lewiston Tribune, and this is the Lewiston Tribune podcast, episode number 5. I'm joined today by Rachel Sun. Rachel is our healthcare reporter, and Rachel works for both the Tribune and Northwest Public Broadcasting at Washington State University. It's always nice to have Rachel's talents on hand. Rachel, how are you today?
I'm doing well, Matt. How are you?
Good, thank you. Okay, and Rachel has a nice story an informative story in Sunday's paper about Kratom, which I must admit, up until about 2 weeks ago, I had never heard of. Rachel, were you familiar with Kratom before you did this story?
Not particularly. I had seen signs for it at as I was driving past smoke shops or there's a store that sells kratom that I actually interviewed the owner for, and I had seen that driving by hundreds of times, but I'd never gone in and I hadn't really known what it was. So this was a fun learning experience for me.
All right. Well, great. I guess tell us, for maybe especially the folks who aren't aware of it, kind of tell us what you learned about kratom. Why do people use it, and what are maybe some of the concerns about it?
Right. Yeah, so kratom is really interesting. It occupies this space between herbal supplement and kind of like a drug, but it's not classified that way. Um, so it is marketed as an herbal supplement, and the main places that you will find it is either at a health food store or at smoke shops. and what it does is it has these two alkaloids called mitragynine and 7-hydroxymitragynine. I think I'm saying that right. If there's any kratom enthusiasts out there, maybe they'll correct me if I'm wrong. But those two alkaloids bind to opioid receptors in the brain called mu opioid receptors. And it's considered what's called a partial opioid agonist, which means that it has some opioid-like effects, but it's not as strong as uh, actual opioids, you might consider like fentanyl or any of the other ones out there. And so there's a lot of reasons that people use this. There's a lot of people who use it for chronic pain, um, and for things like help with sleep. There's, at lower doses, it's used more as a stimulant. And then at higher doses, it has more opioid like effects. So it's, like maybe 1 to 2 grams might be used as something kind of like coffee or instead of coffee. At slightly higher doses, people would use it maybe for its pain relief benefits or other things like that. It's also found a user base in people who are going through opioid withdrawal from harder drugs and are using it as what it's been called a natural methadone. So those are some of the reasons that people use it, that people like it, that they feel strongly about it, because they feel like it's really helpful. Some of the potential concerns with kratom is that it's not FDA regulated, which means that there's no testing that it needs to go through as far as potency or making sure that it is what it says it is. So depending where you get your kratom, you might not just be getting kratom. You could be getting other things mixed into it, or just potentially harmful contaminants, and you wouldn't necessarily know.
Yeah, it's and I guess maybe to cut you and I a little bit of slack. It's not been around that long, right? When did it first start to kind of gain a following in at least in this country?
Yeah, so I don't know exactly when it came over, but it seems like it started getting more popular around 2017, 2018. And at the time, at least in this area, there wasn't a lot of options, like good options to get it, from what I understand. So maybe some smoke shops. What I heard was that Vig's health food store was actually one of the first places in this area to buy kratom. But other than that, people didn't have a lot of options. And from one of the retailers that I spoke to, who co-owns the store Kratom Kings in Moscow, some people were getting into selling kratom because even if you didn't have a great product, you could still sell it because it was such a niche thing.
It's interesting. Your story points out that in 2016, the U.S. Drug Enforcement Agency uh, temporarily classified kratom as a Schedule One drug, and yet it sounds like the kratom fans got them to reverse that plan, and that was unprecedented. Is that right?
Yeah, so what happened was the DEA put out a statement saying they were planning to classify kratom as a Schedule One drug. I don't think they had actually done that yet at the time, but that was the plan. And I don't believe there was any other cases at that point where they had, changed their minds after making that kind of announcement. But there was a really big pushback from the kratom using community, as well as some researchers who were worried about how that would affect their research into kratom, and some policymakers. And so they actually ended up walking that statement back and not classifying kratom, at least for the time being, as a Schedule One drug. And so for the time being, it remains unregulated. There's discussions about whether, some type of regulation might be helpful, but a lot of kratom users are very vocal about what they say are the benefits that they get from kratom. And it's remained quite accessible in most states because of that.
Mm-hmm. It's, as you said, it's herbal, and it comes from a plant in Southeast Asia. Is that right?
Yeah, it comes from a plant that is related to the coffee plant. Not the same, but I believe it comes from like vines from that plant. I might be mixing that up, but there's different types of kratom where it's sourced. So there's like types called green, red, and I think white vein kratom. And those have different levels of those two alkaloids that affect the brain's opioid receptors and give slightly different effects based on that.
As you talk to folks about this, what were maybe some of the concerns about kratom? How could maybe people using it, what are some of the things they should keep in mind in terms of side effects or even just later effects of it?
Right. So one of the first things, as I mentioned, was that because it's not regulated, you can't be sure necessarily about the potency that you're getting or whether there are other contaminants in it. And so that could lead to, potential health risks. Another one is that even though it's not as addictive as things like morphine or, other like quote unquote hard drugs, kratom still does bind to opioid receptors and it can be addictive. One study I found took a survey of almost 3,000 respondents, and about 12.3% of kratom users that they surveyed qualified as addicts. So even though it's not as addictive, it's not something to get into lightly or use a bunch of all the time, because that could happen to you. So then another risk is that kratom has the potential to interact with other medications or other drugs that you might take, things like alcohol, but also, other opioids, other medications in general. You need to be careful about how that interacts. Kratom overdose deaths are pretty rare, but when they do happen, they're usually in combination with some other medications. And this is especially important to note because there is that user base, like I talked about, who might be using Kratom to try and wean off other drugs. Or there might be people who use it and forget that they took it and then have alcohol or something and have a bad reaction. It seems to, like, if people take it and then drink alcohol, for instance, it sounds like they tend to get worse reactions, and at high levels, that could be dangerous. It has some risk for liver toxicity for some people as well, it seems to be, and some risk for causing seizures, particularly for people with epilepsy.
You, as part of the story, you mentioned you talked to one of the co-owners of Kratom Kings, Guillermo Rojo Martinez, and in your story, I thought he had a pretty clear-eyed view of Kratom. What did you was the main takeaway after talking to him? A retailer who does make money on this, but seems to kind of have as I said, a sort of a clear-eyed version of this substance.
Yeah. So Guillermo talked to me about like why his customers use Kratom and some of the things they run into. At his business, they independently send their Kratom to a lab in California to be tested for a couple things: heavy metals, E. coli, salmonella, as well as trying to test the strength of the product. So that's all great. That's not required. And what Guillermo told me is that he is supportive of having some kind of regulation because he's worried that people will buy Kratom or buy what they think is Kratom, and it's not really anything at all, and they get scammed. Another thing he told me is that, he has some guidelines for who he sells to and what he recommends. So they don't sell to anyone under 18 years old. They also don't recommend people take more than 10 grams per day of Kratom because that's when it seems like people start to be getting worse reactions and maybe are more prone to getting addicted at that point. And, he recommends using caution when it comes to that in general, I think. So he doesn't recommend it for people who are pregnant. And there's been some studies done that there can be adverse reactions for infants whose mothers consumed Kratom. Basically, Guillermo's perspective was that people are really passionate about Kratom for a reason, because some people seem to see really good benefits with it. And at the same time, you need to exercise caution and common sense when it comes to any substance like this, and not overdo it and not mix it with things like alcohol.
That from everything you've written, Rachel, about this in your story, I think that maybe seems to be the big takeaway that if you're interested in this and you a fan of Kratom who's had beneficial effects with it, recommends it. You probably just go in with a cautious point of view for all the things that you've brought up. The fact that it is unregulated and does perhaps have some other side effects, but maybe has some beneficial aspects to it as well, right?
Yeah, it's something definitely to be cautious about. The FDA hasn't approved Kratom for any drug use or as a supplement, but we can definitely see that there's people who are very passionate about Kratom and feel that it's really improved their quality of life. And especially, in this medical landscape where it can be hard to access care through a doctor, it's hard to tell people, no, you shouldn't explore any of these options, but they should be really careful about how they do that. And, especially if they're pregnant or have other medical conditions, look into that first, talk to their doctor before they just jump into using something like Kratom.
Rachel, your story didn't really touch on this, but is there a segment of the population that seems to use Kratom more than others? Is it young people? Is it old people? Or is it all over the map?
I didn't get a whole lot on that. What Guillermo told me was most of his customers like to use it for its relaxing and calming properties. A lot of the people who I saw, talking about this online and online forums were talking about using it for chronic pain relief. So sometimes it's older folks, but certainly not always. I think that there's a pretty broad user base, but I don't have, any scientific research on that.
Yeah, yeah. Well, Rachel, thanks for the story about Kratom. As I said, I'd never heard of it before, so it's just good to be aware of this. Someone like myself who has kids, always good to kind of know what's out there. And was there anything else in your research into this that you might want to bring up here to let our folks listening know about?
I think the two things that I would just reiterate is that sometimes people have the impression that because something is natural or herbal, it's not going to cause any harm or that it's less potent. And that's not necessarily the case. Kratom can have pretty significant effects. And some of those might be positive, but they might also not be. One person I interviewed at the Washington Poison Center pointed out, your brain's receptors don't know if something is man-made or natural. They just respond to the chemical structure of it. And like I said, this is a compound that binds to your opioid receptors. It's something to take pretty seriously and use caution with. Another thing I would reiterate is that this can have interactions with a lot of different medications and definitely shouldn't be taken with alcohol or other opioids because that's when we tend to see really negative outcomes and even overdose deaths in some cases.
Well, thank you, Rachel. Thanks for the insight into this, and thanks for joining us on the Lewiston Tribune podcast. And everyone out there, thanks for listening. Be sure to check out Rachel's story in the Sunday Tribune, and we'll be back next week with another podcast. Thanks for tuning in, everybody. Bye bye.